Hi, everyone. This is Julie from Integra Health and Wellness, and I'm really excited to talk to you about something I'm so passionate about: hormones, perimenopause, menopause, this entire transition that we have. Such an important part of our lives, and every woman needs to be empowered to understand what's happening, how you can get ahead of it, how you can make it the best time of your life instead of a rocky road. So today we're going to just be diving into this and making sure we understand all the details about how to move this forward. So this webinar is for you if you are that person who's starting to have episodes where you're like, what is happening? I'm having some hot flashes. Or maybe you're the kind of person where you're having some anxiety, some changes in how you relate to people, just not feeling as confident. Maybe you're seeing that your moods are really shifting. Maybe you're having temperature dysregulation. Maybe your cycle is getting off and you're wondering, what is happening? What is happening to me? Well, this is for you today. So I want to just introduce myself to you. My name is Julie. I know you know that. I'm a nurse practitioner and adjunct faculty at Georgetown University. And what I'm passionate about is getting to the root cause. And that's why I'm certified in Institute for Functional Medicine. And why that's important is that I'm the only certified practitioner in our area for about a 2 to 3 hour radius away from this location. I also have some special interest in training in environmental illness as well as brain health. And so this is me, but most importantly, my story. So my own health took a big dive in the early 2000s. I was in what I thought was amazing shape. But what happened for me was I was lifting weights and just having so much fun doing that. But I got a little bit bored with it. And so I decided to go with a group of friends. I met about 20 different friends, hopped on a road bike, and started cycling up in the hills about 40, 50, 60 miles at a time. Had a blast. I was in the front of the pack from the beginning. But a few weeks into that, my health started to decline. I didn't understand what was happening. And for me, it ended up being a lot about perimenopause. So what happened was I started getting bloated, fatigued, I started losing energy, and I started going through all these changes, so much so that I had to pull out of that. And I really had to grapple with what was happening with me. And at that time, I only had conventional training. I didn't have the functional medicine training. And so I happened to go to a pharmacology conference in the Bay Area, and I met a functional medicine practitioner, started working with that person, and that's really how my health got completely turned around and why I'm so passionate about giving to you the same education, the same empowerment so that you can take control of your health and you can shift it to be back to that vital person that you are. I want to tell you a little bit about Lisa. So Lisa is a practice member here. And when she came, she was having a lot of changes. But you know what? Let's just hear it straight from Lisa. So hi, Lisa.
I
You completed a year, right?
did it. Yep. Yes, I did.
So try to remember back. What were you hoping to accomplish and how are you feeling?
Well, I was hoping to accomplish a few things. Number one, I couldn't get my weight under control for the life of me. I was exercising regularly and eating healthy and um, felt like I was doing all the right things, but nothing was working. I felt like my hormones were all out of whack. My body was just, I was in pain a lot. I couldn't be on my feet for very long because everything would hurt. And so I knew I needed almost like a reset. I knew my body needed a reset. So that's why I sought you out.
So tell us about what you've accomplished.
So number one, I feel just so much better. I feel I lost almost 30 pounds, and I learned that my healthy eating, I learned more about that. Like I could be healthier. I know, and the whys behind some of the changes that I've made. I'm the kind of person that, like, I'm going to stick to whatever is good for me. And I'm pretty stubborn as far as that goes. So, when I learned about different kinds of foods that were better for me, not necessarily low fat, but high healthy fat, my mind just switched, and it became like I understood it. Like, oh, this is what's good for me. It's not no fat, it's good fat. And so it got to the point, even on vacations, I would take my own food with me because I knew I was still, on my regimen. I was not going to waver. So yeah, it's been good.
You were committed.
I was committed. I was 100%. Still am.
Yeah,
Still am.
to your health.
Yes, absolutely. Yep.
Yes. Well, we just are just celebrating with you, and it's
Thank
been
you.
such a delight to work with you. Congratulations.
Thank you.
So we're so excited for Lisa because she's just a great example of what someone just like you can make these changes. And so, Lisa, she knew she needed a reset. Many times what we need in this transition through our hormonal changes, we need a reset. And you can do it. And that's what's exciting. So today, you're going to learn secrets, and the secrets are that you can understand about what these hormones are doing. And secret number two, you can understand how to tell if you are really experiencing, these symptoms, and you can also do something about it in a more natural way, in a way that's going to actually transition you and through it and on top of it. And that's what's super excited. So if you stay till the end, we're going to give you a couple of really great tools. One is just everything we covered today, plus some more about how you can live a really clean life, some swaps that are going to help you to make the best decisions that you can. And plus, I'm really excited because we have this opportunity to participate in a documentary where you can watch even more about a deeper dive into all about hormone transition. Menopause is called the M Factor, and it's a really dynamic documentary where you can dive deeper and understand. So now more than ever, what I really want you to pull away from this webinar is that you don't have to live at the mercy of your hormones, that there is a safe and personalized proven path. So you can not just be living in it, but you're going to be actually living on top of it. And that's what's amazing. So, hormone balance is so powerful, and it's actually going to shift your life and make it completely different. So secret number one, guess what? Your hormone transitions actually start in your 30s. So I hope all of you, if you aren't in your 30s, you're telling your friends who are in their 30s, hey, ladies, this is what's really happening. Like estrogen and progesterone and testosterone are already starting to shift. And the name of the game in this time of your life is that it's unpredictable. So you might feel that, right? You might feel that in how your body's reacting, how your mind's reacting. You're going to even see that other parts of your whole hormone pathway are already starting to shift as well. Thyroid, adrenal, your whole body's way of handling sugars completely starts to change. So then you start having these signs and symptoms, and people will start having irregular periods, and unequal energy. So their pathways will start to get a little wonky because they're cross talking. So even though this is a normal, if you will, way of how we go through things, it's not something that you have to just be at the mercy of. There's things that you can do about it, and that's what we're going to dive into today. So important that as you're going through this, you start to develop a mindset that you're going to base the anchor of your whole hormones in your lifestyle. So I want you to start paying attention with your nutrition, with your movement and your activity, and how are you handling stress? How about sleep? How's that going? And we're going to talk about testing, and we're also going to talk about reducing toxins. So it's one of the most important aspects. So in Integra, one of the reasons our practice members have been able to make transformative changes, people just like Lisa, is that we walk you through an ability to detoxify from a medical standpoint. So we're really just going to help your liver and your gut to be able to work the best so you can get rid of the toxins that are blocking your hormones and making them even more wacky. And this is what we're going to teach you. We're going to teach you nutrition. We're going to teach you detoxification so that you are optimized and you can do it. When we get together and we have a consultation with people, we start to teach you about where are toxins? Why do toxins matter? And we know that we're just surrounded by toxins. They're in our things that we put on our body. You know, when you just get up and take a shower, the choices that we've made, the things that we put in our environment. Many of us love these beautiful candles. They have this gorgeous scent, and yet many of those are just interrupting how our hormones are functioning. And we can go on and on because it'll be pollution, it'll be air fresheners, all different types of things like this that can block your own body's ability. So one of the biggest strategies that we have here at Integra is that we never guess. We don't want to be about just a band-aid or putting kind of a shotgun approach. This is not about trial and error. This is about actually understanding where your health's at. So we do deep dive testing, blood labs, functional medicine labs, and then we understand where your hormones are, where you're at, and then identify any detoxification blocks that you might be having. And then we put you on a protocol that's associated with that so you can walk through a healing journey. And many times we'll do specialized testing later, and we'll talk about that. One of those tests is called the Dutch test. And this is why our clients are having a great time getting control of their health. When you're learning all about this, we set you up for success because we want you to be educated and empowered. That's such a key thing that I want all of you to pay attention to today. Let me tell you a little bit more about the Dutch test. So the Dutch test is a really amazing test. So this test even tells us, how are you getting rid of your hormones? Are you getting rid of them in a way that's safe? Are you getting rid of them in pathways that are going to optimize your health? Are you holding on to certain hormones in an unhealthy way that is going to derail you? And this is one of the things that we'll use. And when we do that, we will decide when it's best to do that. So if you're a woman who's still menstruating, we'll be using that straight out the gate. But if you're a woman who's past menstruation, really not doing that, or you're not having that happen very often, then we'll do some blood labs first, get things moving for you in a direction to help support you. And then we'll initiate the Dutch test a little bit later. But what's amazing about the Dutch test is it actually just shows us how we can optimize you both in how your adrenal system's working, how your detoxification pathways are working, your methylation pathways, all of these things that we can dive in deeper and help you understand about so you can optimize those. I want to tell you about Tasha because Tasha also came to us here at Integra, and she was in her 40s and she just really wasn't feeling like herself. She was, even though she was 40s, she felt like she was in her 80s. And even after just 3 months, what was really amazing for her, and like many of the practice members here, she was able to start feeling like herself again. She was back off the couch. She was back to working out. Aches and pains were gone. She was able to shed some weight, and she was just really excited. Some of the other things that she was super excited about was the fact that in this approach, we're all about getting the root cause questions answered for you. And that's about deep dive testing, customized protocols specific to your results, and educating you about all those results. So I'm not sure if it's ever happened to you where you've gone to some event and you realized I'm kind of caught off guard. I'm not feeling myself. And you ended up kind of picking yourself apart. Maybe you just didn't feel, as comfortable in your own skin. And so many of us on that journey through and to menopause really have ended up feeling that way. But guess what? That's kind of a sign that you are going through some perimenopausal changes. So now we know that's not just a 10-year window. Now we know it's more like a 20-year window. And for some women more like that, others a little bit more narrow. But what ends up happening is those changes actually touch all the different systems of your body. As we kind of dive deeper, this study was really interesting because it really highlights the fact that in perimenopause, that's when really most of the symptoms around menopause are more pronounced. I think there's a misconception that many of us think of that it's really going to be after you stop having your cycle regularly that you're going to have these symptoms. And that can happen for sure. But as you can kind of see from this graph, so just a little orientation to it, that blue line where it really, peaks at the perimenopause, that's really all about the changes that affect how you perceive, how your brain works, how your hormones affect your mood and your emotions. That's all happening the most around perimenopause. So that's kind of a new thought. And then you can see all of the estrogen receptors where they're associated in your brain. So we're talking about regulation of temperature, learning and memory. We're talking about how you function, how you can organize, your executive function, and on and on and on. This is really what we're seeing happen. So then secret number 3 is that menopause is also affecting not only just the brain, but also your bone, your heart, your cardiovascular system, your skin, your emotional well-being. So while we know what these definitions are, right, natural menopause is kind of this gradual hormone decline. Surgical menopause, it's really kind of immediate. And then premature menopause, which occurs before age 40, and that can be for all different kinds of reasons. But the name of the game is that these hormones are now getting lower and lower and lower. And that's what really goes deeper and deeper. So the longer you go without making these hormones, kind of your body keeps shifting and things really can continue to change. So you might see weight gain, you might see sleep disturbances, you might, feel really irritable and wonder, why am I snapping off everyone's head when I really want to be patient? I want to be present and be able to be there for the people that I care about. So just know this is a safe place. You're not alone. This is really part and parcel of this transition of life that you have an opportunity to grab a hold of. So I want to talk to you about hot flashes because guess what? They are more than just an annoyance. So if they start early, it's kind of a chance that they might last longer through menopause. So if that's you, just that's something you need to pay attention with. And also understand that if it's happening later, so I have a lot of clients who'll tell me, I didn't have any of those symptoms until later, but that can also increase your risk of vascular changes. So if you don't treat hot flashes, you can actually lead to more health decline, even in your cardiovascular system, which I'm just naming here blood, in your bones, so your bone mineral density, and in how your brain works. So we're going to dive deep into that. And you can see here on this slide, where are all these receptors at, right? For estrogen, estrogen A is really the accelerator. That's what's going to be building connections in your brain, help your ovaries, your uterus, your bones. And then estrogen B receptor is kind of like the brake. And you can see all the locations where that is. So in cardiovascular health, hormone replacement does not worsen it. It might even be helpful for some things. And that's really an important aspect. For brain, I want you to look at this slide because what you can see here is that the top left quadrant here in pre to perimenopause, anytime you see red, you want red in this case. Red means connection, but you see that as you go through the hormonal changes, even when you're still having your cycle from time to time, your brain is already being impacted. And it goes on and on and on. And you can see in that postmenopausal phase, it really has started to take its toll. So it's super important to take control of things. The earlier you can, the better. So what about bone? And the same answer, and that is take care of it early because it's going to affect your bone mineral stability, the density, how it's made, how it's strong it is, how much tensile strength it has. All of those things are affected by your hormone balance, and hormone replacement therapy can do that. So skin also gets affected. So when you have loss of estrogen, testosterone, you're going to have less elasticity, less collagen, more wrinkles, less hydration, and all of that's really important to get control of. But guess what? Menopause is just a transition. It's an opportunity for you to reset, refocus, just like Lisa, just like Tasha, and you can take matters into your hands and you can reset it and you can optimize. So, and this can mean not just when you're young. I want you to think of it more about when you're in your 30s and late 30s. If things are starting to change, time to go ahead and take action. But what if you're a woman who never did anything and you're already after age 60? Well, we even have strong clinical evidence that it's okay. You might be a candidate to go ahead and start to take things into your hands even at that place. So I want you to just really imagine your life. I want you to imagine a life where you could feel yourself again, where you could think clearly, sharply, kind of get your swag back, wake up refreshed, energized, and no more aches and pains, and really start to live a sustainable life where you're feeling great and you're able to really optimize. So I know many of you might be asking, how can I do this? How can I actually take control of this? So I want to talk to you about what bioidentical hormone replacement is. So this is all about using chemically identical hormones, just like what was produced by your body when you were younger. So can be done in creams and patches, in pills, in injections, or in pellet implants. So there's a lot of different options that'll fit each of you uniquely. And it'll be important for us to find out. So why should you consider bioidentical hormone replacement? And that is because even bioidentical estrogens have been approved by the US FDA, and we can use them to treat these symptoms and to help ourselves be even the best that we can be. And the other benefit is now we understand that one of the studies that was so impactful about 20 to 30 years ago in shifting us away from being able to use bioidentical hormone replacement has now been reviewed just even in the last few months. And this is where you're going to dive into the M factor. You're going to be able to understand even more details. But just a quick summary, and that is that now much of that has been debunked. And really, we understand there is a great ability to use these in a manner that can be optimizing for you and reduce risks. So it's really important that anyone across these time frames can benefit. And it's going to be able to help you as you get control of your symptoms, you get control of how it's affecting your life. That's what's exciting. But let's talk about something that's really important. So what about breast cancer and hormone replacement therapy? So when we look back at the data and we're able to divide out the synthetic hormones from the bioidentical hormones, we can see a big difference. And that's what's really exciting. So what we can see bottom line is that even just estrogen by itself and one particular kind of estrogen, estradiol, and it actually decreased breast cancer incidence and mortality. And I just urge you always to be educated. You can look up these references to just solidify your understanding. And the same thing with progesterone. It is not associated with an increased risk of breast cancer. Now, what we even understand too is that even taking other medications in mind, you can see this quote about any association that may exist between hormone therapy and breast cancer appears to be rare and no greater than any other medications commonly used in clinical medicine that are non-hormonal. So that's super important. And then what about testosterone? So in my practice, I do offer pellet therapy as one of the modalities. Many of you will be a candidate for that. Many of you will not, but it's something that you should know about. And the reason you should know about it is because the absorption rates of pellets, injections, patches, orals, and creams have a varying degree of consistency. So that graph right here just kind of depicts that. But I think one thing that's super exciting about testosterone is actually they're using it as therapy in breast cancer, and they'll actually implant it into breasts where invasive breast cancer has occurred, and they're able to see it decrease the size and the incidence of the tumor. So super exciting. So it's really important to understand about bioidentical hormone replacement and see if you're a good candidate for that. So I want to tell you a little bit about Dolores too. And Dolores came always feeling bloated. She was tired and she was hurting. And she came at the referral of a friend who had also been a practice member. And so when we put Dolores on her customized program, she has worked with us for a year, but in her first 3 months, she started to see these massive changes where she started feeling better, no pain. She got rid of the bloating, she got rid of her inflammation, and she was able to feel much better herself. But what's really exciting is that other people noticed it too, and she just felt overall younger. So that can be you also. So what is so important about an approach here at Integra is that it's customized to you. We make sure that we discuss and you have informed knowledge about what is the very best safety option for you as far as how we're going to address these hormonal changes. And then you can take back control of your life, get back to feeling yourself, and you can get back to living that kind of life that you've always wanted to. Um, Unlike anyone else, right? This practice, we're all about helping you from a root cause, individualized, personalized approach that educates you, that empowers you. And then we always want to be partners so we can mentor you along a healing journey. And we're going to do that by diving deep, testing for you, and helping you with a sustainable lifestyle. So, what other people are saying is just that wow, they were so excited that they got their lives back. They were able to put into action their personalized program and start to see brain fog go away and aches and pains and headaches and heartburn and just have energy and clarity of mind and focus. And people are also able to really just get back to not masking their symptoms anymore with pharmaceuticals, get off of pharmaceuticals, and get back to having amazing vitality, resiliency, and just feeling their very best. So, how do we do that? How we do that is we meet with you. We meet with you individually, and I'd like to offer each of you a 15-minute complimentary discovery call. And how you can do that, we'll have that at the end of the webinar, a QR code where you can go ahead and schedule that with me. And to prepare for that, what I would like you to do, go ahead and have your labs ready and we can discuss it if you have them. And if you don't, we'll talk about your symptoms and we'll dive deep on if you're a candidate for, say, a 3-month program, or if you're more of a candidate for a 12-month program. Wherever you're at in your health journey, we're going to talk about where your goals are so we can devise a plan for you. And one of the questions I get asked is, can I help everyone? And of course, you can imagine I can help the ones who have that strong desire to be proactive, are ready to take change, to take control of their health and really apply themselves. I also get asked, can we meet virtually? And actually we can. So that's exciting too. So if you're on the go and you have a busy lifestyle, no problem. We can make that work. We'll meet this way and really stay connected, support you all along the way. So if you're the one who really wants to take back control of your health, I'm excited to meet with you, and I'm looking forward to us having that 15-minute call. So you can always have that option of just getting more knowledge on your own, or you can have a mentor and a guide, and we'd love to be that guide for you. And this is how you do it. So thank you so much for being with us during this webinar, and I look forward to talking with you one-on-one. Can't wait to meet with you.